So the data we presented at this meeting has been looking at the more mature, longer data set, looking at progression-free survival and overall survival in the patient population from the phase 1 trial of the combination. And that's showing a meaningful, exciting looking progression-free survival. We already predicted this from the earlier data, which led to the development of the Atlantis study, which is a randomized phase 3 sort of pivotal registration study in second-line treatment of small cell lung cancer. That study has been recruiting and actually closed to recruitment this summer, so it's completed recruitment successfully, and we're waiting for those results to report hopefully sometime early next year. The world of clinical trials and the management of lung cancer is changing so rapidly with immunotherapy drugs finding their role in multiple different settings that it makes the development of other agents quite difficult. As much as anything else, trying to find out what the standard of care is really changing on a year-by-year basis. So one of the challenges, I think, is establishing the role of lurbinectedin within the changing environment of treatments at the moment. Having said that, I think that the activity of immunotherapies in the second-line setting has been less promising in small cell lung cancer than we had hoped, although earlier today we saw the data looking at it in the first-line setting in combination with chemotherapy, which may well become a standard of care, which would still, I think, sit lurbinectedin combination as a second-line treatment very appropriately. So I think there's great optimism for this combination. In my mind, obviously, we wait for the Atlantis data to see how that pans out in the phase 3 study, and that's really the critical step, I think.